You're here. Welcome to our webinar, Health Equity at the Commercial Tobacco Point of Sale. A few logistics on our end, you'll see on the next slide. Closed captioning is available today. We will be recording the session and sharing slides and resources that we discuss over email after the fact. All of the participants are muted today, but you can chat with panelists and use the Q&A to share your experiences and guide our conversation today. Feel free to engage however you are most comfortable. Welcome and special thanks to our speakers as well. We are so lucky to have such a breadth and depth of experiences and research on the panel today, as you can see, and folks will be introducing themselves in more detail, their communities and their work as we go. Real quick, I'll spin through our agenda before I hand it over to Marcela for a welcome. We're going to start with an intro from the National Alliance for Hispanic Health and Nuestras Voces, Marcela. We'll ground the conversation in some definitions, and then we're going to walk through some policy options for promoting health equity at the commercial tobacco point of sale, as well as during the policy process itself. And we'll hear from communities, staff about their experiences working on policy in a variety of different contexts. So we'll be talking about general principles here that span specific populations or groups and identities that might be the focus of our work in different geographic regions and policy issues. So let's use that chat and use the Q&A to share resources and contexts that are related to this work. We'd love to help make those connections and really deepen that list of resources. So before we start, we want to be really clear that we are talking today about commercial tobacco and nicotine, and we recognize the important role of traditional uses of tobacco in Indigenous and tribal communities. Also, another disclaimer, we want to thank our funding partners at CDC OSH, the Office of Smoking and Health, but remind everyone that today's webinar does not necessarily reflect the views or policies of the CDC. And now we'll head back to that agenda and pass it to Marcela for some introductory remarks and some context for what we're hoping to accomplish today.
Thank you, Sarah. Hello, everyone. Thank you for participating in our important webinar today. My name is Marcela Gaitan, and I work at the National Alliance for Hispanic Health. I'm the Senior Director for External Relations, and I also the Program Director for the Nuestras Voces, Our Voices Network program. We're very excited that we are addressing the issue of point of sale and health equity in particular, but we're also very excited that we can partner with our friends at ChangeLab Solutions. And we're also very thrilled that we have such great speakers for our webinar today. So just to give you a little background about the Alliance, next slide, please. We are a public health organization. We are based in Washington, D.C., and our mission is best health for all. We work to ensure that health is based on what we know about people, science, and culture. And we're also the largest in all the Hispanic network of community-based organizations that provide services to over 50 million people around the country each year. The core value of the work that we do is that we believe in community-based solutions. So we partner with community partners around the country that provide services to a variety of services to Hispanic communities. We also do not take any funds from alcohol, tobacco, or sugar sweetening beverage companies. Next slide, please. So, and just to let you know about some of the work that we're doing, one of the initiatives that we're implementing that is related to commercial tobacco use and cancer prevention is the Nuestras Voces, Our Voices Network program. And this is part of the Networking to Save initiative funded by CDC that is addressing population-specific strategies to address the tobacco use prevention, commercial tobacco use prevention, and also cancer prevention. So Nuestras Voces is working to expand collaborations and in particular meaningful partnerships so we can address the threats of commercial tobacco use in cancer prevention, in particular in Hispanic communities who are underserved. Next slide, please. We are working with 6 community partners that are helping us expand the reach of the program, and also they implement activities at the local level. And our partners are currently in Chicago, Illinois. We work with the Hispanic Health Coalition. We work with the Hispanic Federation in New York, El Centro de la Raza in Seattle. We work with the Hispanic Health Coalition of Georgia in the Atlanta area. We also work with the Cancer and Chronic Disease Consortium in El Paso, and then with Family Health Services of San Diego. Next slide, please. So the program has 4 main strategies. So the work that we do is implementing, for example, we develop a national network where members can join the program and they learn about the activities that we're conducting as part of the initiative. We're also working the provision of training and technical assistance to a variety of partners, including programs at the state level, the programs that are funded by CDC, to address commercial tobacco use prevention and cancer at the state level. We also work on the development and implementation of tailored interventions, in particular to support Hispanic communities around the country. And we also work on the implementation and dissemination of mass health communications as well that are culturally proficient and language appropriate. Next slide. We are addressing health equity by connecting Hispanics to culturally proficient tobacco and cancer information and support services. So, for example, I'm talking about cessation services for Hispanic communities, so cancer screening services. For example, for women who need to get their breast and cervical cancer screening, annual screenings. We work, like I mentioned before, we work also on the development and implementation of tailored interventions that are culturally proficient and language appropriate. And we collaborate with other organizations to increase the reach of the program, and in particular to address the health needs of Hispanics in relation to commercial tobacco use and cancer. And we also forge community-based partnerships for capacity building and also program implementation at the local level. And like I mentioned earlier as well, we work on training and technical assistance, and then also with the implementation of evidence-based intervention and promising practices to reach and serve Hispanic communities. Next slide. So just before I close this, my part of the presentation, I also wanted to mention that the Alliance is also involved in other activities related to commercial tobacco use prevention. And one of the concerns that we have is the increased use of Hispanic youth using vaping products and e-cigarettes. So we have worked on in an area of advocacy to help, for example, stop the sale of these products in online. When we look at the numbers for e-cigarette use, for example, among youth, we know that all the youth are actually using tobacco products, and in particular, Hispanic middle school students are the group most likely to use e-cigarettes. So we're definitely concerned that this is something that we need to address, in particular for the Hispanic youth. And it's interesting because when we look at the number, we look at the prevalence data for tobacco use in Hispanic communities, adults tend to have a lower prevalence in terms of tobacco use. But when you look at the number among youth, that's what we call the tipping point, meaning that Hispanic kids are more likely to be at high risk of using e-cigarettes, and then they're probably the next generation becoming addicted to nicotine. So that's kind of the area that we're looking into addressing. And as part of that, we did the Alliance published an article where they did a literature review in terms of e-cigarette among Hispanics. And some of the things that it showed is that, Hispanic adolescents also are at risk for experimentation with e-cigarettes at early ages. And this is what I mentioned before, that it's potentially leading to nicotine dependence. But for adults not exposed to e-cigarettes during adolescence, there is less prevalence of tobacco use, and in particular e-cigarette use. So we know that looking at the point of sale, looking at the ways the youth are getting these products is something that we need to address. So I'm glad we're actually working with our colleagues from the American Heart Association, our colleagues from the tobacco program in California, from ChangeLab Solutions, to work in partnership to address this issue that affect Hispanic communities. Thank you, Sarah.
Thank you so much. And thank you for the inspiration. We always love partnering with y'all and really feel passionately about this work. So we're going to start by grounding the conversation in some definitions. Just a reminder here that though I'm a lawyer, we don't provide legal advice or express views on any specific legislation, even though we will be talking about a lot of policy options that can happen through legislation. So at ChangeLab Solutions, we work with partners across governments and community-based organizations and cross-sector teams to work on upstream solutions to improve community health and health equity. That's our mission. When we talk about equity, we are thinking not only about improving outcomes for those experiencing the biggest disparities, we are also talking about creating fair and just opportunities to be as healthy as possible, looking at this definition of health equity from Dr. Paula Braveman out of UCSF. So not only in the opportunities that are available to people to be healthy, but also in reducing the barriers that are preventing them from accessing those opportunities. So some people find this image of the difference between equality and equity helpful to illustrate the need for person-driven solutions that meet people where they are. Each person has the bicycle that suits them and their goals. There's no one-size-fits-all solution. And I'll also note that this image has its limitations. The metaphor goes, what about people for whom there is no bicycle that meets their unique needs, for whom another form of transportation would be better? And zoom out farther still, how are these folks' choices and goals influenced by where they live? The bike lanes, the traffic, the air quality, and how far are these individuals wanting to go and for what purposes? Equitable policy addresses these questions as well, not only a list of 4 different bike options or policy options, but also the surrounding community context and the processes to help everyone identify and pursue their varied goals. In ChangeLab's Blueprint for Changemakers, we identify 5 fundamental drivers of health and equity that we are always trying to incorporate into the policy research and planning process. Go back 1 slide, I'll go through them. They are structural discrimination, including structural racism, income inequality and poverty, disparities in opportunity for things like jobs and education, disparities in political power and representation, and governance that limits meaningful participation in organizations and institutions and in government. So if you want more on how to address these drivers and how that can promote health equity across a range of policy areas, including tobacco and nicotine use prevention, check out the blueprint on our website. So I want to do a quick check-in question with everybody. Feel free to drop your answers into the chat. The hosts can see them and respond back. You can also drop any questions that are coming up for you or connections to your work in the Q&A. The question is, which of these fundamental drivers feels most relevant to the health inequities you're trying to address in your own work? So again, that's structural discrimination, income inequality and poverty, disparities in opportunity. It looks like chat is disabled right now. Thanks for the heads up. While we figure that out, if people want to go ahead and pop into the Q&A and drop it in there, we can use that. We've got it pulled up. I see governance that limits meaningful participation is up right now for some folks. So that's certainly relevant. I know we've got income inequality and poverty, and structural discrimination. Again, lots of number 5, lots of governance that is limiting meaningful participation, which is especially powerful since we're talking about process today, almost as much as we are talking about the specific menu of policy options that are available. So let's tick through to the next slide. So equity is nothing new, right, to the field of tobacco and nicotine use prevention, right? We are talking all the time about the disparate health burdens of product use among different demographic groups, which varies by region and neighborhood. We're talking about industry targeting of people and communities, the under and over enforcement of laws that are meant to protect everyone equally, how upstream influences like the neighborhoods we live in, how they shape our personal choices, and even how commercial tobacco industry presence in our communities can block opportunities for local investment and development. Next slide. So COVID has highlighted these inequities that underlie our communities, from income and food security to opportunities like jobs and good education. So approaching the retail commercial tobacco environment provides an opportunity to zoom out and address not only tobacco and nicotine use, but the bigger picture of creating healthier communities. And policy is one tool for making this community level change that can be more efficient and effective than other interventions alone. A policy is something that lays out a course of action for an organization or another entity that is in writing, it's documented and institutionalized, it has some built-in accountability measures, and it's broadly applicable. It reaches more people. So yes, laws and regulations are policies, but also institutional policies, even contracts and agreements that set out a course of action. These are also policies in the way that we're talking today. And policies can either advance or impede health and health equity, as you can see on the next slide, depending on how they are implemented. So in the next slide, you'll see how at the point of sale specifically, policy can promote community health in a number of ways. Retail policies can help track and maintain relationships with retailers, monitor and improve protective policies like Tobacco 21 at the local level. They can shift conversations to focus on product sales and our environments and away from a focus on users. And they can reorient community conversations to focus on local investment over national corporate interests. Retailer policies can also help youth more easily avoid products, help people who are thinking about trying or restarting old habits can more easily avoid those products, and people who are trying to quit have a better shot of succeeding. So now I'm going to hand it over to Tyra to walk us through some of the policy options at the point of sale, noting some of those equity implications and possibilities. And we'll get an introduction from our panelists from Texas and Georgia and their communities and related point of sale policy work. Tyra?
Thanks, Sarah, so much for that great introduction, and Marcella. Happy to be here. So I'm just going to quickly discuss some of the point of sales that Sarah was referencing. So all of these points of sales, just want to disclosure that they're going to be in our point of sale playbook. There's a link right there, and I'm sure we can share that with you if you haven't been able to see it yet. But I'm just going to quickly go over these policy options. So, sorry, slides issue. Okay, so we have place, proximity, prevalence, price, product, and promotion. And these are all policy options that are designed to promote health equity in the retail environment through reducing the overbearing presence of commercial tobacco products, creating more space and visibility and affordability for everything else. And we'll spin through each of these examples separately. So the first one is place, and place can change where products are sold, both inside and outside the store and in our neighborhoods. So changing those power walls, policies that influence online sales or disallowing pharmacies to sell tobacco and nicotine products would be examples of product-based, place-based, policies. This kind of loops back to what Marcella was saying earlier in reference to fighting online sales, which I personally think is something that is evolving at a faster pace that we can keep up with sometimes. So online sales are complicated for local policy intervention, but it's definitely a growing area. And next we have proximity. Proximity policies come under its place as well. For example, prohibiting retailers from selling tobacco and nicotine products near schools, libraries, playgrounds, etc. A lot of community gathering places, a lot of places where youth are those are the policies that tend to fall underneath this proximity category. Oh, went too fast. And then we have prevalence. And this is a place-based policy focused on reducing density or the number of tobacco and nicotine product retailers by capping the number based on geography or population size, or by requiring minimum distance between retailers. I think this is definitely a policy that's one of the most well-known, especially as it relates to health equity, and definitely a big national focus on this one too. And then if you're interested in place, proximity, and prevalence, check out our infographics and other resources on reducing retailer density. I believe Sarah just dropped one of the links into the chat, if I'm correct. So if you want to check that out, that's great too. And then next we have price. And price, some examples including setting pricing floors, minimum package sizes, and using taxes. Pricing strategies are often proven to be effective which can improve health equity, yet pricing strategies are regressive. That is, they will most impact people already affected by the costs and harms of using these products. So the policy process should be transparent, nuanced, focused on shared values. It's going to involve some hard conversations. I feel like this is one of the toughest ones to really talk about in communities. And it can be an opportunity for community leadership. For example, in determining how to spend tax revenues by investing in local programs, youth educations, or health retail efforts. And then we'll talk a little bit about pricing strategies. So here is a fact sheet, a handy infographic that we developed. Oh, I'm clicking on things that I shouldn't be clicking on. Back to pricing strategies. Oh no, what's happening? Okay, there we go. So we have minimum pricing, coupons, discounts, and promotions, implementation and enforcement, and then health equity upstream considerations. And then one of the next P's is product. Policies covering products, for example, packaging sizes, flavors, menthol, synthetic nicotine, vaping, and any other new developing products that come down the line. We've all seen work happening around the countries on flavors and menthol. That's been really big lately. And we're eagerly watching the FDA's rulemaking process at the federal level. No matter what it looks like there's always going to be a role for local product-based policies to stay involved in an area where health inequities are so well documented for Black and African American communities, as well as Hispanic and Latinx communities as well. And then we have promotion. So policies influencing promotion include prohibiting the redemption of coupons and promotions, which capture more price-sensitive consumers like youth and people with lower incomes. Storefront signage policies fall under this category, and both require some thoughtfulness when it comes to the First Amendment. But in most jurisdictions, these can be tools for changing the visibility of these products in our neighborhoods and on our streets. So these are all of the P's that I just went over in one place, each with its own equity implications in terms of process and impact of these solutions, and each with its own challenges. I think this is definitely something that is easier said than done sometimes, but definitely something that is worth considering in doing point of sale strategies. So we're going to pause and introduce our panelists and learn about their community goals and their point of sales policy work. So Christina, we'll start with you. Oh, I think you're on mute, Christina.
So sorry.
Okay.
Hi, and thank you again for the invitation to share our information from the Coastal Health District with everybody. So glad to be here. So I am trying to control my slides.
So Christina, So Christina, your slides are actually later. I think at this point, if you could just introduce yourself and list the point of sale policies you've worked on, and then we'll get into your the details of your process in that section.
Okay, sounds good. Okay, so I'm Christina Gibson. I'm the Chronic Disease Prevention Director for the Coastal Health District. So I am the 8 counties along the coast of Georgia. And so I'd like to introduce you to our communities that we serve. We are basically looking at the third largest St. Patrick's Day Parade in Savannah. We're the Hollywood of the South, because Georgia is now the Hollywood of the South, and we do have a lot of films that are filmed here in coastal Georgia. We have beaches too, and 3 large military installations. We've got Fort Stewart, Hunter Army Airfield, and also the Kings Bay substation. So we do have a large military population here. So we do get about 15 plus million tourists to our coast. So we do like to make the environment appealing to them because they are a great source of our income. And we also want to make it, you know, wonderful for our residents as well. So let me see if I can.
And then, yeah, Christina, if you just want to share what point of sale policies you have worked on.
Sure.
Yeah.
So basically, we are working on Tobacco 21. We already have a lot of comprehensive policies in place, like we do have the smoke-free indoor air ordinances in the city of Savannah, the Chatham County smoke-free indoor air, also city of Pooler, and then we also have a smoke-free beach in Tybee. But we're dipping our toe into the point of sales arena through the Tobacco 21 work that we're doing. So that was actually effective January 1st, 2021. It is making the minimum age to purchase tobacco products 21. It's illegal for persons under 21 to use tobacco or e-cigarettes and vaping devices. And it also prohibits smoking or use of vaping devices within a school safety zone. It does require signage, has required verbiage for signage, and it was overwhelmingly supportive in the legislature. It was 123 to 33 in the House, and then 52 to 0 in the Senate. So it did have great support. We're attacking place, proximity, and product with this this law, State Bill 375. Okay, and it is limiting youth access to the product. So let me tell you about some of the challenges.
Well, Christina, let's pause real fast because I know, you know, I think we wanted to get into the process afterward, and you'll have your slides and everything. So, but right now, just a kind of a preview of what we'll hear you talk about, and I think we'll especially appreciate how the point of sale policies and the smoke-free policies are all kind of like working hand in hand. So, Jerry, why not just like in 1 or 2 minutes, just who you are and what are the point of sale policies that Tyra has mentioned that you have worked on?
Sure. Hey, everybody. Jerry Saavedra. I'm with the American Heart Association. I'm a community advocacy advisor. Previously was a community advocacy director. And basically what that means is I work with cities and counties all over the country on various policies that the Heart Association, along with a lot of our various health partners, support related to tobacco. That has mainly been a lot of smoke-free work, worked on tobacco retail licensing, worked on Tobacco 21, and more recently, flavors is another policy that we're working on. In my role, I'm not in one community per se, so I've kind of worked in a variety of communities across the country. I do live in San Antonio, and I was born and raised in El Paso, Texas, so I was excited to work all over the country and be able to work in South Texas in the border, and then in Denver, and a lot of communities that have a high number of the Hispanic community in El Paso and in South Texas. We're not a minority, we're the majority. So look forward to talking a little bit more about how we've worked with the various policies in the various communities. Also just want to quickly just say the ChangeLab resources, especially on our tobacco retail licensing campaigns, they're just really simple and effective, and the video that is part of the resources, like one of the best videos that we've shared with all of our partners that work in that. So I think this is a really great resource, and glad that we're having this conversation today.
Thanks, Jerry. We didn't pay him to say that, everyone. Tyra, we'll kick it back to you to close us out on the policy menu, and then we'll talk about the process.
Sure. Thanks, Sarah. Thanks, Jerry and Christina. So just to wrap up, there are multiple ways to implement these points of sale policies depending on your goals and limitations. Local laws and regulations, zoning codes, and licensing and permitting. And what works in one place may not work in another. And it's important to make sure that it's tailored to your specific community and your community's needs, especially as it pertains to, political will, funding, capacity, for implementing partners, or because of preemption. When a higher level of government, like a state, prevents a lower level of government, like a city, from making laws in a given issue. And then, so just a shameless plug to check out our recent preemption playbook in partnership with Counter Tools that walks people through the preemption analysis process, how to process the ways preemption might influence your policy work. And then we have the local policy benefits. So local policy efforts can be more rooted in their unique community goals and with more buy-in, and build on local progress and partnerships that are already in place. Local policies can reduce the risk that they will have unintended consequences, that the policymakers won't have the right people and the ideas on the radar, and local policy can pave the way for national change. So if you take nothing else from this slide, take away that local policy is a bigger agent than people give it credit to be sometimes. And now I switch it back to Sarah.
Thanks, Tyra. So we're going to turn to the policy process as an opportunity to promote health equity. And we're also going to hear in more detail from our community panelists. I know that was such a tease, but you will get to hear more from them, I promise. So we don't need to read through the list on the next slide, but the main takeaway is that equity is about more than outcomes and reducing disparities, both of which are, of course, extremely important. It's also about process, about listening, about honoring community power and the work of so many before us and alongside us, and sustaining that respect and connection throughout the life of the policy. In our tobacco retailer licensing playbook, we lay out a detailed version of one policy process for retailer licensing. So this is the detailed infographic that we are not going to go through in its entirety, but so you know that it's there and it's part of those resources. And it's helpful, I think, to see it mapped out like this and how it's all these like overlapping pieces. So on the next slide, I took out the retailer licensing policy like specifics of it. And what you see is really a set of things that apply to any policy process. And all of these moments along this big, messy, overlapping process, they are all opportunities for community leadership, which are opportunities for equity. By rooting any of the solutions that we are working on in the goals and experiences of those whose lives are most affected by the issue. We've selected just a few, I think 3 of the 10 steps here to highlight and provide some deeper resources on. So starting out with the assessment stage, naturally, an early opportunity to embed equity in the policy process. In our recently updated fact sheet on the next slide, we talk about how health impact assessments, health equity impact assessments, and other early assessment phase work can provide that strong foundation for an equitable policy process, including some great examples around the country in this fact sheet. So that any policy change is going to be grounded in a deep understanding of the health priorities, the community goals, and the lived experiences of residents. Another step of the policy process, convening a coalition, provides an opportunity to embed equity by centering lived experience. You'll hear these redundancies embedded in the process that can create strong partnerships with residents and community-based organizations, including retailer groups and all other types of stakeholders. The public participation spectrum here outlines the process of shifting from engaging a community to empowerment, or sharing power and funding and leadership and decision-making with community members. So from inform to consult to involve to collaborate to empower. And we won't be reading through the details of this chart, but you can dig in when it's shared later. The point here is that we try to take advantage of opportunities in the policy process to move to the right of this spectrum. Is there a way your coalition can be more than a source of data, more than an outreach engine? Can it hold decision-making input or authority? By doing so, a process can grow community relationships and build trust in a process that can otherwise be, has the risk of being alienating. Another step of the policy process is around education. So as distinct from lobbying, that's just outside of the scope of our discussion today. You know, these conversations are not just about raising awareness of a policy issue that you're working on. It's a chance to identify and connect over shared goals and values, to provide local insights and data and stories, to be sure the public and the decision makers alike are aware of how tobacco and nicotine retailers can affect the health of the community and what can be done about it. We're now toward the end of the policy process. We're at implementation and enforcement, and these steps provide avenues for health equity to be a policy defining goal. You can change the specific provisions as well as the process by which they are implemented. And equitable enforcement is the process of ensuring that compliance with law and policy considers and minimizes harms to underserved communities. In our equitable enforcement guide, we talk about options for making enforcement a tool for equity and not the opposite. Things like graduated enforcement provisions, ranges of sanctions, the use of non-punitive enforcement measures, careful designation of enforcement bodies, and guardrails for discretion and ongoing training, as well as data collection and ongoing evaluation that updates the policy. So you can check out more in our guide if that's where you are or where you're interested in really implementing equity in your policy process. Because you can use it to use the equitable enforcement piece of the puzzle along with all the upstream approaches and the process of engagement and empowerment so that the policy doesn't just get passed and then seem to forget its own goals and its own community. Finally, the step we're going to talk about today is the evaluation step, another opportunity to think about how surveys and data gathering and data reporting and sharing back can center equity by seeking out a full representation, the whole story of how the policy is rolling out, intended and unintended consequences, as well as a process to evolve and respond to that feedback, sharing it back with the community so that others can see what's going on and can use the data. Data that's gathered and filed away can be extractive and limiting, providing an incomplete basis for the work and stagnating the policy. So now we're going to finally get into it. I know it's like the moment you've been waiting for. Let's get back to Christina and Jerry to talk about how they pursued health equity throughout the policy process in their work. They talked about their point of sale policies, but they've been doing so much policy work that spans a lot broader than that. I'm hoping they'll bring in some lessons learned from the whole process of all the policies they've worked on. So Christina, we'll send it back to you. And now you should have slide control. And this should look familiar, Christina. Yes?
I got so excited. All right. Again, good to be with you all. Let me see here. There we go. Okay. So just wanted to recap where we are. We're in 9-1. We're at the southeast corner of Georgia. We do have a lot of visitors that we need to protect from secondhand smoke and from the dangers of tobacco. Sorry, I just put these pictures on here because St. Patrick's Day parade. And we do have Driftwood Beach, which has become the backdrop for The Walking Dead in the past. So it is, and Fear the Walking Dead is actually filmed here now. J-Lo got married here. In my districts, and those are the military operations I wanted to show you because we do have a lot of tourists and a lot of people that are, living here temporarily that we need to protect. But of course, we need to protect our residents, and we do have 5 rural clusters in our district and then 2 urban clusters. We're looking at people that are mixed race groups that have high representation as single parents in families with or without children. Most have a high school diploma or less. The group mainly works, this group mainly works in the service industry, earning lower than state average income. They live in rented apartments or old houses that have low housing values. And then the average per capita income for the Coastal Health District is $27,000. So it is quite low, but we do have a lot of things going for us. So there are some disproportionately affected by tobacco populations that we are trying to protect. Okay, so the protective factors that I alluded to are, we do have all of our counties or all of our school districts, our public school districts, protected by a tobacco-free school policy. We do have tobacco-free campuses. As I mentioned, those local smoke-free indoor air ordinances, and for the city of Tybee, we have a smoke-free beach ordinance, which has resulted in 75% less butts on the beach after a 4-month period. We have smoking cessation classes offered at all the health departments, and then the Georgia Tobacco Quit Line that offers 4 weeks worth of nicotine replacement therapy free of charge. And then also access to This Is Quitting, which is a vaping text cessation program. So a little bit about the Tobacco 21 implementation that we are working on. So the state, the Georgia Department of Public Health has given us great support locally to help with the implementation of this law. So it did go into effect January 2021. It does raise the minimum age to 21 to purchase tobacco products. It makes it illegal for anyone under 21 to purchase e-cigarettes or vaping devices. It prohibits smoking or the use of vaping devices within a school safety zone. It requires specific signage with verbiage, and this is the verbiage that's required, that sign. And we weren't typically seeing that in our point of in our tobacco retailers locations. And as I alluded to, it did have overwhelming support in both the House and the Senate. So when we talk about the local challenges and the response, we did have a little competition with the virus that will not be named here, because it did pass in 2020, in the summer of 2020, when we were having our big surge of cases. The community, when we were checking back with them this year, was mostly unaware that this law had been passed. And the retailers did definitely know about this change, and they were mostly compliant. We did see a notification about the age being lifted and that they would ID, not lifted, but the age raised. So in support of this law, what we were able to do is we were able to get our district health director, Dr. Davis, to send a letter to all of the tobacco retailers that had a compliance inspection in 2021, because in 2020, those compliance checks were actually halted through the FDA. So in 2021, they resumed the compliance checks. We sent this letter to all 225 locations in our district that had compliance check. We provided us that sign so that they could put the proper verbiage up where it's visible. We did have a media campaign, including billboard, radio, print, and also speaking engagements. I was able to go on tour spreading the gospel about Tobacco 21. And we also did site visits and talked with the tobacco retailers regarding their role in helping our youth avoid, the impact, the adverse health effects of tobacco use and e-cigarette use as well. So this is what we are hoping to see with that, because we're a little limited in our data, but we're hoping to see a decline in our youth cigarette use, a continued decline, and then a decline in the disturbing increase in our youth nicotine vaping. That's incredibly, the spike is incredibly high here. Improved community health outcomes, and then more health protective environments in our neighborhoods. So I would love it if anybody had any has any ideas to share or any questions. Here's my contact information, and I'll hand it over back to Sarah.
Thanks. And I will hand it straight to Jerry. I think his slides are directly next to launch in. Oh yeah, there we go. Thanks, Dylan.
Yeah, thank you all very much. I'm going to go ahead and jump in. I'm going to be talking about Denver Flavor Campaign. And just a quick background on Denver. The Hispanic community represents roughly 30% of Denver's population. So obviously it's very important to the Hispanic community. It's significantly younger, so a lot more Hispanic students represent about half of the students enrolled in Denver's public schools overall. And on the council itself, 4 of the 13 members are Latina. And so going into this effort, there was definitely a big focus on looking at, a strategy for how we engage the Hispanic community as a major partner as part of this campaign. And then secondly, the other campaign is just like all the South Texas smoke-free work. The map on the left is when I first started working for the Heart Association. I was assigned to look at, where in Texas can we work on smoke-free work. My hometown of El Paso was actually the first city in Texas to pass smoke-free, and then all over the country, just various cities. But if we looked at South Texas, there had been Harlingen, Brownsville, and a small town called Alton were the only ones in South Texas where a lot of the community were suffering from health disparities and diabetes and a bunch of other things that we felt addressing exposure to secondhand smoke. And as Christina talked about earlier, the folks who work in the service industry, and I think during the pandemic, we learned this, the folks that still have to go to work more often than not, was definitely an equity issue of, if you're a lawyer, if you're a city council member, when you go into work, you're not being exposed to all these toxic products. But if you happen to be a server, a waitress, a bartender, for whatever reason, folks feel that that's still okay to be exposed to secondhand smoke. So at the end of about 2018, we had about, if you can see, a large number, pretty much like every single city in Hidalgo County had passed a comprehensive smoke-free work. So that's kind of the 2 examples I wanted to pull from. The first thing that I just wanted to talk about, and this kind of going more in Denver, is how important framing the issue is. So, the Mona Lisa with a wacky frame around it doesn't look as cool as, this fancy frame. And so it just kind of, no matter what the content is in the middle, how you frame it really has a huge impact on our policy issue. And so when we're looking at talking about eliminating the sale of flavored products in the Hispanic community, and talking to Hispanic elected officials, making sure that, well, let me take a step back. I think a lot of the focus on the menthol and the flavors policy, and rightly so, is focused on the impact to the African-American community. And that's a huge part of that issue. I think what gets talked maybe a little bit less is the impact on the Hispanic community. And so really being intentional and creating some specific talking points that would resonate more of like, why, in addition to the African-American community, does the Hispanic community also should care about this policy? And so really making sure that we're showing the ads that we're targeting Hispanic communities, again, referencing that half of Hispanic smokers use menthol cigarettes, again, not as high as the rate that African Americans, but still a very significant part of the problem here. When we're looking at e-cigarettes, highlighting all the different flavors and churro and all the other tres leches and all of that type of stuff is specifically intended to attract Hispanic and Hispanic youth. And then when we're looking at the little cigars, again, there are just so many different types of flavors that, folks don't understand that cigars are the second most popular product among Hispanic youths. And so with flavors, a lot of time the policy tries to get focused on e-cigarettes, and that's it. But we need to make sure that when we're framing the issue, we're framing it more broadly to not just be e-cigarettes. It's also a problem with flavored cigars, flavored, menthol cigarettes, and the broader, Sarah mentioned earlier the importance of building a strong, diverse local coalition. So this was the overall coalition in Denver, and then wanted to explicitly point out some of the Hispanic organizations. Servicios de la Raza was, there's already organizations and communities that already have the trust of the community, that already work in the community, that you really need to, it's so much easier and strategic to work together with those organizations as opposed to trying to start your own coalition or for national organizations like the Heart Association, Lung Association, and Cancer Society, and others. We are very, we have groups of national organizations, but then every community has those local based coalitions that day in and day out work in the community, are made up of folks in the community. And so making sure that I think there's a role for national health organizations, and then there's the role for the local organizations. And when we work best is when we can collaborate and work together and have the best of both groups. In South Texas, there was already an existing local tobacco coalition, and this is the group there. And as you can see, it's representative of community members themselves. And I especially wanted to highlight the lady on the left and the little girl. Her mom, and that's her granddaughter, had her daughter died of she was a bartender, and she credits being working in a smoking environment as contributing to that. And so having those local community members, and it was publicized, and people in the community were well aware of that. And so we can throw out all the statistics we want, but it's the real stories of how secondhand smoke and how these products are impacting the community that I credit her for single-handedly convincing council members that we're going to vote no to vote yes on a number of campaigns. Grassroots community engagement, of course, we all on policy campaigns, we have the supporter cards, the action alerts, all the traditional things that we try to do. But I wanted to just kind of point out on this call that we really need to make sure that we're creating resources that are bilingual when that's required, or thinking about different community events that are already going on, and making sure that we're not just doing the same old tactics and strategies without thinking through how is it going to be most received by the community. Things that are done online, not everyone has online access, and so just being mindful of different things like that. I think that for polling, I just wanted to highlight that we did a McAllen specific poll, again, wanting to make sure that folks understood how does how do folks that live in McAllen feel about it. In Denver, there was also a poll that was intentionally oversampled 200 Hispanic respondents, and would ask questions about how they felt about the flavor policy and various other questions. Hispanic community is not a monolith. There's different communities, whether you're talking about South Miami, South Texas, Denver, different in the New York area, various amounts of some Cuban cigars are part of the culture. So having to navigate and not just assume that all Hispanic community members are going to be supported right away, but trying to make sure that we're doing an assessment and really learning what folks' views are on it, so we can again make sure we're framing our message the right way. Here was some collateral that was developed using that polling, of really again wanting to our strategy of making sure that we're saying this is what we've polled the Hispanic community in Denver, and this is what some of the quotes and featuring prominent voices of community leaders and people that are well respected. So again, kind of mirroring the statistics with the quotes and the stories and testimonials of folks that have that trust of the community. This was a community panel that we had put together, and I wanted to highlight this to show that the co-host came from an organization focused on LGBTQ. We have the Tobacco Control Leadership, African American Tobacco Control Leadership Council, Dr. Gardner, who's a leader nationally on the equity issues around flavored tobacco in the African American community. Nita Gonzalez is a local person with Servicios, and so making sure that we're really having the diverse conversation and having representation from the various groups that can talk about it from the unique perspectives of the various communities. Quickly on media advocacy, op-eds, editorials. Again, just an example of making sure that we're working on different messages and praising communities for doing what's best for the community. In the middle of this picture is Sister Norma. She's a really famous, she works for Catholic Charities of the Rio Grande Valley and is featured in Oprah and all sorts of, she does a lot of great work with immigrant community in South Texas. And so a lot of time there's people that they don't live and breathe tobacco healthcare policy. They work on other issues. But if you can explain why this is important, they'll lend their voice when maybe they'll attend a committee meeting, or they'll pick up the phone and call a council member, or take action in a variety of ways. So I think we need to also make sure that we're not just talking to the same people and talking to ourselves that are involved in healthcare policy, but thinking about what about faith-based community, the business community, some other non-traditional stakeholders to also be supportive of the policies that we're working on. And a lot of this was already discussed by Sarah, but really assessing your community on the front end and figuring out what do you need to be successful, planning, campaign management. We can't just overall, I think that's all really important things to really work through as a team, and it not being one organization kind of going in with an agenda, but really making sure that we're working collaboratively. And that's why I really like the tools that have been shared, that really kind of help put together a process and a structure that communities can come together and have those conversations. And I think that it's pretty much it. I'll end there. Thank you very much.
Thank you so much, Derry. And I realize we're getting really close to the wire on having time for Q&A. We've got one question in the chat from one participant that I'm definitely gonna address. And so go ahead to the next slide. We're gonna spin really quickly through. We have a number of resources that are connected to some research that we did in partnership with, Frameworks Institute did the research, and we put together these materials, and I dropped the link in the chat. But there are a few slides in here, and I'm just going to spin through them. Justice in the Air is the name of the full report. You can see all of the different resources that are kind of cropped out of there, including talking points for folks working on a variety of different issues and among different populations. So tick on through. There are some slides that show you examples of like specific messages, sort of what the basics are behind how we think about framing. The way we talk about these issues changes the way people think about them, and then what they do about them. So shifting from that portrait frame to the landscape frame, from individual behavior to our environment, to our communities. But just flagging that for you, check out the link in the chat. And now I want to get to these first questions. So the first question has to do with marijuana legalization, cannabis legalization, and how that influences policy work. I'd love to hear from you, Marcella, if you've got a national perspective on this. Jerry, obviously your work in Colorado is going to raise this a whole lot. And I can say from my experience providing technical assistance in the field, I've seen it anecdotally go both ways. In some communities, I see that as like an accelerant that gets everybody really excited about getting together on the overlapping policy opportunities. And others, I think there's a cooling effect that happens because they're waiting to figure out what's going on in the cannabis space. And yeah, go ahead.
Thank you, Sarah. One thing that I can actually share is our partners in Seattle, the Centro de la Raza. They're actually working very closely with the Department of Health, and they're really active. They actually have a task group or a coalition, and also a task group actually addressing marijuana prevention. So I definitely recommend the colleagues to check out the Department of Health in Seattle, in Washington State, because they're actively working on that issue. And it is a complicated issue because, in one hand, we're trying to educate the parents, for example, some of our activities, helping educate parents about what kids are using, the type of product they're using, specifically related to e-cigarettes prevention. But then, many youth are using these same products to use marijuana derivatives or marijuana ingredients or other types of products as well. So it is definitely complicated, but again, I think I want to refer everyone to the Department of Health in Washington State, because they're doing a lot of work specifically on marijuana prevention. And if not, I'm going to put my email in the chat, and if everybody's interested in learning more about that, I'll definitely be happy to refer them to our colleagues in Seattle, the community agents that we're working with, because they're actively involved with them.
I dropped their Twitter account into the chat as well. Jerry, anything to share from your experience in Colorado?
I would just say that it does complicate things, and it's like, well, why are you trying to, like, at one point legalize this, and at the other time trying to make this harder to get these flavored products? I just, in honesty, I think I'll speak for, we're still looking at the health impact. It kind of feels to me like 2015 e-cigarettes, where people are trying to catch up on what like there's not the long-term health studies of the impact of Delta 8 and all the nuance of the different products that are coming out and being legalized. I'm actually working on a smoke-free campaign right now in Nashville, and there's a business, Buds and Brews, that came out. It's like a bar and grill, but they have THC-infused sauces and drinks and vape stuff, and that definitely threw a wrench in there. So I think we're going to start to see more and more of those types of businesses pop up, and I think we need to figure out how we're going to address that. I don't think we're there yet.
Christina, before I move to the next question, anything to add from what you've been hearing in the field?
We haven't delved into that at all.
Right.
Yes, our state is still in the medical marijuana phase. We haven't gotten into recreational yet. So we are looking to you all
Right.
for that experience.
Yeah, so share those resources. We've got chats coming in. And the survey link in the chat, that's a great idea. I've got to track it down. Dylan, actually, can you copy the hyperlink from the presentation and drop it in the chat? Thank you. I'm so sorry. I really appreciate it.
I'm on it. Of course.
Yes, awesome. The next question, I know we've got 1 minute. The next question was about success getting retailers involved in ways that like result in community praise. I know there was like Healthy Retail that was affiliated with the tobacco control program in California. In San Francisco, there was some success on that, but that was all pre-COVID, and I would guess that the stories are really quite different. So drop things into the chat. Thank you all so much. I feel like we are at time. There's the link in the chat. Yes. We'll tackle those questions and send out a follow-up email. Thank you to everyone. I want to be respectful of time. Go, Jerry, go.
Just real quick, I just want to make sure that a lot of times we're seeing that the tobacco industry and others are trying to say, well, we're good with TRL, but we don't want to do flavor. So they try to pit our policies against each other. And I think we just need to be careful with that. So I just want to kind of flag that, obviously we need all of the above policies. And sometimes they try to say, well, we'll give on one and at the expense of trying to kill another one.
Yeah, that and all of that subject to the political process and how we're all making those trade-offs when we do policy work, right? Yeah. Thank you again, everyone. We'll compile these resources and send it out. The recording and a link will be made available. Thank you to our panelists sharing your work on the ground. Thank you. So Dylan, we can go ahead and stop recording.